My name is Okewoye Unique, and I'm a 20-year-old Nigerian girl who is based in Niger State and I school in Ondo State. The name of my initiative is Health Impact for Youth. Imagine a generation of young Africans who understand their body, can advocate for their health, have access to resources, and become change makers even in their communities. That is what Health Impact for Youth is building. Health Impact for Youth is addressing the issue of health illiteracy, poverty rate, and gender inequality. Why I care about the problem, it has affected me directly and indirectly. Directly in the sense that I've lost people due to health issues that could have been addressed promptly if there was adequate information. Indirectly in the sense that I grew up in the northern part of the country and I saw firsthand how ladies suffered from issues that guys were exempted from because of the issue of gender inequality. So that's why I thought, rather than keeping this problem to myself, why not find a way to solve it? The first collaboration we had was in September 2024, where we collaborated with a nursing association in Unimed, Ondo State. The topic of discourse was suicide, and we brought a therapist, somebody who was vast in the knowledge of suicide prevention and mental health, to come and speak to young adults on how to prevent suicide. In this discourse, we could talk to young people about identity crisis, comparison that is being shown and showcased on social media. So that's one of the collaborations I've done. Several others include collaborating with mental agencies to talk about mental health, collaborating with a fitness brand to talk about physical health, since the issues we address are related to health. Health in the sense that it's all-encompassing, physical, mental, and sexual health. So far, we have been able to reach about 5,000 youths through online campaigns, WhatsApp outreaches, one-on-one conversation with young people, inviting guest speakers, conferences, webinars, and all of that. One story that keeps replaying in my mind was when we went for a sickle cell awareness in the secondary school. And the principal of the school told us that she had lost somebody earlier that day due to sickle cell. But she thought that it was probably a spiritual problem, that, oh, God had taken somebody close to her. And after the awareness program, she could realize that what she thought was a spiritual problem was actually something related to genetics. And she told us she could tell people who cares to listen that, oh, sickle cell is not the cause from God, but as a result of genetic issues, which can be prevented and avoided if there is screening and adequate information regarding it. Health Impact for Youth work on the 3 SDG goals: SDG 1, 3, and 10, SDG 1, no poverty, SDG 3, good health and well-being, SDG 10, reduce inequalities. So one of our aspirations is to reach about 100,000 youths by 2030, and we are working on that because we have reached about 5,000 youths already through virtual events, community outreaches, one-on-one conversations, and even our ambassadorship program. The ambassadorship program is one that is designed to equip young people with the right information, the right knowledge they need to become also advocates of the same thing in their communities. Because we believe that if we want to create a ripple effect of change, we have to change one person, that person has the capacity to change others. One of our mantra is making a difference together, and we believe to achieve that is to do this. My advice to young people who want to become change makers is that you don't have to be as big or as popular as Superman to do big things. Even as someone as small as Ant-Man can do great things. Great things start from small places. So start small, never downplay your ideas, identify a problem and start with it. Work towards providing a solution to that problem you have identified. Start from wherever you want to start from. You are not too old and you are not too young to do great things. When I first started Health Impact for Youth, one of the questions that I was asked was, how would you combine nursing with an initiative? How would you go out of school when you are in a private university? Are you sure you can do this? Don't you need to identify yourself and be done? Don't you need to have enough money? Don't you need to be grown enough and be able to understand everything before you started? And I started to rethink the idea. Oh, probably I should wait till when I'm done with school. Probably I should wait till when I start making money. How would I fund? How would I gather a team? All of these questions kept coming in my mind all over and over again. But while reading books, while speaking to mentors, while speaking to teachers, I discovered that the best time to start is now. Because the longer you delay an idea, the longer the restrictions to that idea come into place. One of the things I believe, and one of the things that I for why holds dear to heart, is that everyone can be a change maker. This is why we have our ambassadorship program that is designed to equip young people to become advocates of their health in their communities and society. We believe that if everyone becomes a change maker, the impact that we want to see in the society will be evident.